And you'll see from the slide that we have essentially two different types of opportunities. The first one is something that is an elective course. So the students have a free elective that they can choose from during the curriculum. And they currently have the opportunity to go to Ireland and South Africa. We have been going to Japan prior to the earthquake, and we're hoping to return there next year. Right now it's been on hold. And then there's always the potential for another country. We're actually looking at China for the spring of 2013. So that's a new opportunity for us. And then there's also the opportunity to do an international experience as part of one of our required clinical courses. And that's what these students will be talking to you about. Currently we're going to Peru, Nicaragua, and the Dominican Republic. And then the opportunity might be soon to perhaps go to Jamaica as another part of one of our required courses. And so with that, I'll turn this over to the students.
Good morning and welcome. My name is Brooke Bettis, and I'm a senior nursing student from Boise, Idaho.
And my name is Jessica Fuentes. I'm a senior nursing student from Middletown, New Jersey.
We're here to talk to you today about our international clinical experiences this spring.
Okay, so where I did my community health clinical was in Waslala, Nicaragua. If you can see, it's in the center of the country. It's located about an 8 to 10 hour drive on dirt roads from the capital that's Managua.
Mm-hmm. And my trip was in Chulucanas, Peru. Peru is obviously in South America, and we were there in Chulucanas. It's about an hour outside of Piura. We were in the city of Chulucanas, but that also included visits and education in outer-lying communities that were very rural.
Okay. So in the spring of 2011, our junior year, Brooke and I went on a service break experience through campus ministry. Now, these experiences are open to all majors. They can be Habitat for Humanity or Mission, or they can also be domestic or international. So we had the opportunity to go on a mission trip to Chulucanas, Peru. And when we went with the campus ministry group, we were also fortunate enough to have gone alongside a group of nursing students. So we were both able to tag along with the nursing students to home visits and their community health teaching. But I think that the most inspiring part of all was seeing how well received the nursing students were in the community, not only from the health workers, but from the community members. And they had such a big impact, not only this year when we went, but you can see from the past years as Villanova has been going there for about 14 years. So you could really see the difference when you went there and how well received we were. And this experience in Peru, I think, was the reason that I chose to do my community health clinical in Waslala, Nicaragua.
And I've actually been interested in the international clinical experiences since I heard about it during my candidate's day 4 years ago. When I began nursing school, I didn't really consider community and global health as part of a nurse's job. However, after going with Jess the first time and seeing the impact that the student nurses had in Peru, I knew that I wanted to return as a nursing student. So this spring, for my community health clinical, I returned as a nursing student to Chulucanas, Peru. This program for undergraduate students is unique to Villanova. Not only are we learning about international health, but we get to put it into practice in another country for our clinical rotation. This experience had such an impact on me. I made lasting friendships with fellow nurses and relationships with faculty. It influenced my view of myself, my work as a nurse, and my future career.
So in the weeks before our trip, rather than going to clinical 2 days a week, we met with our groups, about 8 nursing students and 2 to 3 faculty members, to prepare for our week in Nicaragua and Peru. And we did this by assessing the history, culture, socioeconomic factors, and religion of the communities that we were working with. We also did some research on the leading health indicators for the communities, such as infant and maternal mortality data. And this helped give us a really good idea, not only of the community that we're going to work with, but for our teaching plans. It really helped us form our, form the best way that we can get through.
Mm-hmm. And through communicating with the health leaders in the communities who are living in Chulucanas, and also with our knowledge from the previous trips we'd gone before us, we as student nurses identified 4 priority health problems. We split into groups of 2 students, and each came up with a presentation to help teach our specific topics while we were in Peru. So for example, my topic that I was educating about was diabetes, which is a huge problem in Chulucanas.
So after 24 hours of traveling, we finally arrived in our destination in Waslala, Nicaragua. As I said before, it's located in a very rural and mountainous area in the middle of the country, and the communities from there can be even farther. They can be hours or even days of walking and hiking away. So while in Waslala, we worked alongside of the community health workers, did some home visits, visited the local hospital. We were able to speak and talk with the nursing staff there. We were also fortunate enough to have an overnight experience in the communities. There's a picture of it. Sleeping in hammocks, and we did a lot more. So all of this allowed us to really be fully immersed into the Nicaraguan culture, and it added so much more to our clinical experience. The main focus of the Waslala experience is being able to work alongside of the community health workers. So the community health workers are volunteers from the Waslala region who provide basic care by taking vital signs, doing basic teaching, and even providing some medications to the people of their communities. So with very limited access to health care that exists there, these community health workers are probably the most important people to provide health care in the region. So there were about 25 of these community health workers who traveled hours and hours by foot to meet us at the compound that we were staying and attend our teaching sessions. So our teaching sessions covered 4 main topics. They were pneumonia in children, postpartum care, high and low blood pressure, and eye problems. And these were all ones that we researched in our preparation ahead of time to that we thought were of most importance. So in pairs, we customized our teaching for the learning needs of each community health worker to better prepare them to better relay this to their community members. We focused more on the home remedy aspect rather than medicines and vaccines and other treatments that may not be as accessible to them. For instance, I did my teaching on pneumonia in children. So instead of focusing on antibiotics and vaccines that would be used, we kind of tried to teach about physiotherapy, the importance of coughing and staying well hydrated, and other things that would be more easily accessible for them and the community members. One other thing that we did was we were able to teach the community health workers how to take blood pressures. A lot of them, because we've been going down there in the past, this was more of just a refresher course, but it was still, it was really interesting that we were able to bring them to a maternal home and a home for the elderly, and with double stethoscopes we were able to teach them and provide one-on-one teaching with them as we checked over their skills.
And similar to the Waslala group in Chilicanes, a main component of our trip involved meeting with the community health workers, and that included a panel at the end of the week where all the nursing students sat in front of members of the community, nurses, and community health workers and answered their questions. But for most of the week, we spent our mornings doing home health visits and our afternoons educating in the community. In Chilicanes, access to healthcare is limited to a small hospital and a clinic, and there's also a team of doctors and nurses from the United States who come once a year to do surgeries. Even with these minimal resources, the community lacks the resources to pay for these health services as it is. So the community health workers had previously identified who needed to be seen by us throughout the week. So we divided into groups of 3 students. We each had a faculty member with us along with a translator, and then we split up and went to our patients' homes. In the homes, the student nurses are responsible for the entire visit, assessing, treating, and educating our patients. This was an incredible opportunity to use our education and training from 4 years to help our patients. I'd never before felt so responsible and useful as a nursing student. We may have been the only medical attention that these people saw for a month, maybe even a year. We saw a variety of issues: diabetes, joint disease, chronic respiratory ailments, colostomies, missing limbs, even psychiatric issues. I was grateful to have the tools and knowledge to treat some of these things, but also very inspired to teach about the prevention and management of these problems without the tools that we have in the United States. For example, when treating diabetes in the US, often rely on insulin and medication, but that's not something that was available to many people in Chilicanes, so instead we focused on teaching diet and exercise, using local foods to illustrate what would make up a good meal, and trying to incorporate exercise into their lives in a way that was feasible for them. In the afternoons, we used our presentations to teach community members. Sometimes we were in the streets teaching to 20 people, and sometimes we were in a church completely packed with over 100. Often we would see people come and dress up in their Sunday best with their whole families on foot just to come see us and learn more about how to help their community. I was overwhelmed by their eagerness to learn and humbled by the respect and gratitude we were met with. as a nursing student, sometimes I feel like the bottom of a totem pole. You know, I'm always learning, and we're not yet quite ready to practice on our own. But with this trip, it reaffirmed to me what a direct, immediate, and lasting impact nurses can make.
So what really sets the international nursing opportunities at Villanova apart from other schools is that we're not just going there to provide medication and take vital signs. We focus more on teaching and prevention and working towards longer lasting goals that we accomplish each and every time that we visit. As Villanova has been going to Westlaw for the past 9 years and Chulucanas for the past 14 years, we really have great partnerships in the communities that allow us as students to have an even greater impact. We learn in the classroom that the best way to create a lasting example is to work in partnership with the community, and I think that this is the perfect example. Many of the community members in Westlaw may not have known Philadelphia and definitely didn't know Pennsylvania, but one thing that they were all familiar with was Villanova. We're part of a legacy of Villanova nursing students, and we have a lasting relationship with everybody that we work with.
And when we graduate, we'll know that Villanova students will continue to return to Chulucanas and Westlaw and continue to be working with these communities to help them. In 4 years, some of you might be part of that same legacy. If I could give any advice to any incoming freshman at any school, it would be to seek out new experiences like this. Even if you're not necessarily interested in international health, it's an opportunity to make a bunch of new friends, to learn a lot, and to enhance your knowledge about another culture. During and after the trip, we were urged to reflect and continue to discuss what happened with our classmates. This was not just another week of our lives, but rather an opportunity to discover more about ourselves and the impact we can make on behalf of a population in need. And you can see they're throwing up their Villanova V's. Thank you.
Thank you.
Hi everyone, congratulations. My name's Caroline Kuckler. I'm a senior nursing student here as well, and I'm from Radnor, Pennsylvania. I participated in a pediatric enrichment opportunity in the Dominican Republic because I had heard so many positive things about these experiences throughout my time here at Villanova, and I felt that as a senior I finally had the skill set and was prepared enough to put it to use. Similar to the Peru and Nicaragua course, each week prior to traveling to the Dominican Republic, my clinical group would meet with the faculty, 3 pediatric nurse practitioners, and we would learn about the culture, the history, and the state of healthcare. We worked also on our health promotion talks that we were to give to the communities that we visited. Topics included domestic violence, environmental conservation, and self-esteem. Each day when we were there, we traveled around to different communities, and they were so incredibly impoverished beyond anything I could have ever imagined, as you can see from these pictures. We also would meet up with a mobile clinic team that included 1 doctor, 2 nurses, and 1 pharmacist. The students would do intake assessments, including vital signs, heights and weights for both adults and the children. We would do head circumferences for the babies, and then we would plot the children's data on a graph to determine whether or not the children were malnourished or not. Then we would send the adults to see the doctors and the children to see the nurse practitioners. We also had the opportunity to sit in on the consults with the pediatric nurse practitioners when they would see patients. And when the patients were waiting, we were able to teach them the health topics that we had prepared. Once we were finished seeing patients, we would go to the schools and speak to the children. Even though we were doing what might be considered to be very basic healthcare here in the US, like giving out antibiotics, vitamins, or aspirin, the people that we saw were so incredibly grateful, and these seemingly minor things that we were able to provide for them made such a huge impact on their day-to-day lives. We were also given the opportunity to spend a day observing at the regional hospital. While we didn't do anything clinically based, it was such a profound experience because it really demonstrated the disparity in access to healthcare and resources that this population is dealing with, which in reality is it's indicative of the status of healthcare around the world. I remember being so overwhelmed at the amount of people who were waiting in the emergency room just to be seen. Once someone was admitted, they were admitted to a room with 5 other patients. There was virtually no infection control being practiced, no use of gloves. Sinks were almost impossible to find to wash your hands. There were virtually no nurses or doctors on the units in case the patients needed something or there was an emergency, which is a huge contrast to what we're used to here. So the reality is, though, you know, despite what we had seen and the differences between the hospitals there versus the United States, the people are really just doing the best they can with what they have. Overall, it was an amazing and an incredible experience. I'm so lucky to have been able to be a part of it. I can honestly say that I've thought about this experience in some way ever since we've returned from the trip, and I know without a doubt it's going to make me a better nurse in my future practice because of the perspective and cultural awareness I've gained. Thank you.